pyogenic granuloma. The other entity we want to talk about is Glomangiopericytoma. I just highlight the feature is hyaline blood vessel because really similar to the entity we already talked about, nasopharyngeal angiofibroma, but from the entity you won't find this hyaline vessel. And also another two differential need to bear in mind is glomus tumor and solitary fibrous tumor. We will talk about them later. So pseudostratification epithelium with this monotonous looking spindle or maybe oval shaped cell, different size of blood vessel. Sometimes you will see this grand zone. That means from the epithelial and stroma tumor cell, you will have some area without tumor cell. And extracellular red blood cell, this spindle cell forming kind of like vesicle structure. And then this is the characteristic hyaline blood vessel wall. You won't see this vessel in nasopharyngeal angiofibroma, but sometimes you will see this vessel in solitary fibrous tumor. And then all of these monotonous cell hugging around the vessel kind of feature make you confused with glomus tumor. But one differential because of the location in the head and neck nasopharyngeal area, it is really rare to see glomus tumor, but IHC staining can help you do the differential diagnosis. Show you the vessel with this monotonous spindle, some oval looking cells, hyaline blood vessel kind of characteristic, and then immunostaining SMA positive in this monotonous cell. Of course, glomus tumor, you will also find the same immunostaining. But beta-catenin, both cytoplasmic and nucleus, more importantly nucleus, because almost all the cells will have cytoplasmic beta-catenin positive. But if you find nucleus staining, we call this is the true positive beta-catenin. So far we already talked about two entities with beta-catenin positive. That is this one, Glomangiopericytoma. The other one is nasopharyngeal angiofibroma. We already talked about the differential diagnosis. Solitary fibrous tumor, statistics, we will talk about this entity. For the glomus tumor, we also can see this monotonous cell hugging around the vessel, but like mentioned here, extremely rare in the sinonasal area, and then also only SMA positive but negative for beta-catenin. So this Glomangiopericytoma, let's see some characteristic finding. We have some edematous area, some hypercellular area, really bloody. And then let's see the characteristic vessel. This hyaline blood vessel wall. See, hyaline blood vessel wall, not like angiofibroma. Kind of hyaline blood vessel wall hugging by this monotonous cell. These cells sometimes they can form this whirling structure, really bloody. They look really identical. Remember the characteristic immunostaining SMA positive and beta-catenin positive. Another area also the same, hyaline blood vessel hugging by this monotonous cell. Sometimes the cell can form in this whirling structure. Another one, even in this power, we can see tons of blood vessel. But when we zoom in, we can see kind of characteristic hyaline vessel wall hugging by these monotonous cells. So for me, really identical to the glomus tumor. You really need the immunostaining to just help you make the final diagnosis. Glomangiopericytoma.